So I'm an internist by training, also secondarily board certified in addiction medicine. My health took a toll. I think I, up until the very end, gave everything I could. I refused to compromise my standards and practice Walmart medicine. Like, I'm not anti-Walmart. They have good, decent stuff and reasonable price, whatever, but they make it up on volume. I was so sick, mentally, physically. I was absolutely broken. And she said, Karen, if you're going to get out of this alive, you're going to have to practice some Walmart medicine. And I said, I'm sorry, I won't do it. What kind of role model and effective parent can I be to my adolescent girls who are also going through their own struggles and journeys? And how can I be a caregiver to patients, right? And really be good. And so I channeled my energy, but then I was depleted at the end of the day. I thought I was a hero for showing up for family dinner. You know, I look back, I was a shell of myself. I was there in body.
But
oh yeah, no, I was not present. And I can even remember, it's almost like a little trauma reaction. I remember in my head, I was nodding and smiling and hearing about the kids' day and whatever we processed that day, thinking, how quickly can I get back to my computer? And I never turned it off. I didn't know how. Slow down and just pause and know that we can choose. We don't have to respond to every stimulus.
Welcome to Cake for Dinner. This is not your everyday mom podcast. We laugh, we curse, we tell the truth, and we're here to ditch the perfection culture. Dr. Flannery, welcome to Cake for Dinner.
Thank you. We're finally here.
We are finally here. So I think what would be good is just to jump right into your profession, you know, who you are, let the listeners know so there's some context for our conversation.
Okay, good. Thank you so much. I've been looking forward to this. We've been talking about doing this for a while, and I'm really grateful for the opportunity. Love some of the previous guests and podcasts.
Awesome.
And it helped me understand your style and like feel comfortable getting real here.
Yes.
So, you know, so I'm a doctor, I'm a mom, I'm a CEO, founder of a company, medical director, like, you know, wearing a lot of hats, but, you know, at the end of the day, we're all human and we're on this human journey together and just doing the very best that we can. I appreciate opportunities to get vulnerable and just kind of say it how it like is, right? So I'm an internist by training, also secondarily board certified in addiction medicine. I am the founder, CEO, medical director of Palm Beach Wellness Institute, which is a concierge, physician-led, team-based, integrative approach to recovery and wellness. We sort of have like a recovery division that focuses on substance use disorders, mental health concerns. And then what we found is because it's so integrative, really patient-centered, client-centered, and incorporates lifestyle medicine and pillars of wellness, we're like, why are we limiting what we're doing to people with substance use disorders? There's lots of people that want to get healthier and feel better inside and out, mentally, emotionally, and change behaviors that no longer serve them, that might not be a substance or an addiction per se. And so, but there are people that maybe don't want to sort of be lumped in with people who have addictions or recovery. So we really have a whole side of our company that is the wellness division, and that's going really great too. Historically, I've been practicing medicine in Palm Beach County for about 25 years now. And the first 18 years, I did something completely different. It was not concierge. I worked in a hospital all day, every day, all night. It was all the things. I was the medical director. I founded our private practice hospitalist group before that was the thing. And like an OG hospitalist, basically. And I loved that job. I loved the patient care. I still miss it to this day. Really sick, complex, acute, and, you know, the culmination of chronically ill patients.
What did you love about that?
Well, what I loved about it was the thing that ended up making me not be able to do it anymore. And it took like forever, like 17 and a half years for me to figure it out. I was, I guess, just whatever, educated and trained and naturally good at the medicine side of things, right? What I loved was pulling up a chair, seeking to understand, trying to make a human connection with what became an increasingly shorter and shorter period of time that we had to touch them, in a humanistic way. The turnover, the pressure as I
based on
worked
insurance.
get them in, get them out kind of thing, slap some Band-Aids on, don't really explore the root cause. And the longer I did it, the more I realized that, but wait, I do want to explore the root cause. I want to do this as a team. It takes a village. There's stuff underlying this at home that, and in their relationships and in their stressors and in their lifestyle choices, or, their food, their movement, their coping strategies, manifestations of chronic stress. I wanted to explore all of that. And it was just, finally, some gracious, beautiful person in healthcare administration pulled me aside and said, Karen, you're just a square peg in a round hole. What you do is beautiful, and this is not the place to do it.
Right. Which is so unfortunate, right? Because it's obvious that has lended itself to you exploring concierge services, because that just makes so much more sense. But it's also kind of sad because everybody should get that care, right? It's like, it's just...
I was an idealist for a really long time, to my own detriment. Like, my health took a toll. I think I, up until the very end, gave everything I could to patient care and to the team that I directed and to maintaining those high standards and those ideals. And, and at the end, the pressure was on for more and more productivity and patient volume and things like that. And I couldn't do it. And I told my mom, Mom, I refuse to compromise my standards and practice Walmart medicine. I'm not anti-Walmart. They have good, decent stuff and reasonable price, whatever, but they make it up on volume,
Sure.
And it's good enough. And at the end, I was dying. I was so sick, mentally, physically. I was absolutely broken. And she said, Karen, if you're going to get out of this alive, you're going to have to practice some Walmart medicine. And I said, I'm sorry, I won't do it. And where I thought I would, kind of go down with the ship, I was the one that started this hospital-based practice. And I gathered my family, my young family around at the time. My kids were, teenagers, early teens. And my husband, who's always just been so gracious and supportive in my whole career. And I just said, guys, I'm sick. I'm sick. This is not sustainable. I can't do this anymore. I've historically been the breadwinner for our family, and I will find something else, but I have to stop doing this as soon as physically possible and change everything, because I am broken. And what kind of role model and effective parent can I be to my adolescent girls who are also going through their own struggles and journeys? And
we're supposed to be teaching them how to at least attempt to have some balance, have some boundaries, all the things. And when we're not living that way.
And how can I be a caregiver to patients, right? And really be good. And so I channeled my energy, but then I was depleted at the end of the day. I thought I was a hero for showing up for family dinner. Family dinners have been historically very, very important to us. And my kids, now that they're older, they're like, we love family dinner. When can we have family dinner? And so my husband, I did well. I chose a good husband, and he does for the most part, the cooking, and it's wonderful. And he also values that family time. But when I would just sort of show up for family dinner like a hero, I look back, I was a shell of myself. I was there in body.
You were there, but
oh yeah, no, I was not present. And I can even remember, it's almost like a little trauma reaction. I remember in my head, I was nodding and smiling and hearing about the kids' day and whatever we processed that day, thinking, how quickly can I get back to my computer and follow up on those pending labs and those x-rays and see what the cardiologist consult said, and make that phone call to the nurse. And I never turned it off. I didn't know how.
It's hard too, though, because I know when, I work with teenagers, and I'm as passionate, I think, as what you're describing. And it's hard sometimes because you have this passion for this thing that is good, right? You're helping people, but absolutely. You also have a family at home, right? And yourself, which for women, and that's one of the reasons I really wanted to have you on today, is I think women often neglect themselves, right? I think it's just like a thing. We hear about it all the time, but I don't think we hear very often how that truly impacts you. And I don't think we hear what to do instead. And one of the things that I've read that you talk about a lot is caregiver overwhelm.
For sure.
Does that apply to being a mom? Certainly.
1,000%.
Right.
And, it's sometimes it's like inextricable when we're a caregiver, parent in the healing, helping profession and also going through our own journeys. This idea of codependency, enmeshment, especially as a parent, it's so terribly confusing. It gets slightly easier as our kids get older. But when we have dependent children, like it is our job. We are responsible for their well-being. But where does that separate from like, this is their journey? They need to figure some stuff out. And I can't always direct that journey. I can't fix everything for them. I certainly can't learn for them. How do kids learn what works well for them and what doesn't work? It's by doing and making mistakes, right? We know that
So hard to watch.
Yeah, it's terrifying, especially when your nervous system is perpetually on overload in a fight or flight response, and especially when my career identity is a fixer and a healer. I'm supposed to be able to fix that stuff at home too. And sometimes it would be to the point where, one time my husband so lovingly ushered me back in line and said, Karen, I know you go to work all day and you give doctor's orders and everyone just kind of does what the doctor says they need to do. He said, you're at home now, be a mom. You don't come home and give orders. And I was like, heard, thank you, needed that. But really it was some other loving, professionals in my journey, healing journey, that took me aside and said, let your kid's journey be their journey, right? And did it give me some sense of identity and purpose in my role as a mom to like try to fix my kid who was struggling with her own depression and anxiety? Yeah, sure. But I felt totally 1,000% responsible for her well-being because she was a minor, she's a dependent, she had mental health struggles, she was challenging and, going through some really, really challenging times. Of course, it took a toll on our mental well-being, the stress of trying to navigate that while I'm running a company and doing patient care for all these hours and my sleep and everything are a wreck. So it was all mixed up together. It was very, very confusing.
Yeah, and that's where it does get confusing. And the other thing that I think I found very confusing is having a child that struggles with mental health, because that doesn't necessarily line up with a child who's behaving badly, let's say, or where your codependency can be more glaring and make more sense. When your kid is struggling with mental health, it feels natural that you are then responsible for them and for sort of how they're navigating life. And also a lot of stepping in, explaining them to teachers or explaining them to people. And it gets very murky.
They're so fragile and they're so vulnerable. If your kid had leukemia or like brittle type 1 diabetes and they could fall into a diabetic coma, like you would not let them have negative consequences. It wasn't it's behavioral health. Their mental health impacts their behaviors, but it's a sickness like any physical or medical condition. And I totally saw it as such. There was anger and resentment at times when the behaviors didn't fall, align with our expectations.
Yeah, because just because you understand the behaviors doesn't mean they're easy. It doesn't mean that you're always going to receive them well.
But I couldn't just say, nah, you figure this stuff out, learn the hard way, fall, maybe not want to.
Good luck.
Yeah, maybe risk like not wanting to live, you know what I mean? That kind of thing. Or just the pain of retreating to a bedroom, on your phone and doom scrolling because everything else is just too hard. And by the way, my daughter made me promise I wouldn't come on this podcast and talk about her being on her phone all the time. No, I told her. She's like, what are you going to talk about, Mom? And I was like, well, like our journey, whatever, my journey and, being a caregiver at home, at work. And she's like, you're not going to go on and tell everybody about how I'm on my phone all the time. I was like, okay, so how is anybody not on their phone all the time? Like,
I feel
not
like everyone her age relates, and majority don't even think that that's a problem.
Yeah. But yet, she identified and we realized, is it a phone addiction? Yeah, probably. But what's addiction? It's escapism, right? It's trying to numb out feelings that are just not, you're just unwell, ill at ease.
You just want out.
And I just don't want to be in touch with reality. So I'm going to escape into somebody else's reality or, multiple hits of, feeds or whatever it is that you're on your phone.
I've always said I'm in Alcoholics Anonymous and I'm sober for a few decades. And I have always said, I think they could just call it Escapes Anonymous. I mean, at the end of the day, we're just in a spot where we want out, and it just depends on which window you're jumping out. And so if it's a phone, it's still sort of the same process,
for sure.
you know? I love that you're able to get vulnerable about that experience. I would love to break down sort of what happens when somebody is having caregiver overload, or let's just call it motherhood overload for purposes of this podcast. What happens in your body, like specifically? Because for me, my daughter was diagnosed with OCD in 4th grade. It was so anxiety provoking because she was almost at the point where she was agoraphobic and couldn't leave the house. I had other kids to parent. I had a job. So you're pressured to sort of try to get her to, get out of the house do these things. And so that process lasted a few years. And so over that time, now that I'm looking back on it, and she's done amazing, thank goodness, with exposure therapy. I want to make sure I point that out. But what happened, I think, in my body over those years, I think my nervous system is full fried.
Yeah. Thank you. It's such a totally relevant question because it really defines my journey and the pivot to a healing journey, and actually not only saving my own life, and actually reversing aging. So I'm 53, I'll be 54 soon. And so I like to say, 7 years ago when I was older, I was rapidly aging. I was dying. I was dying.
Really,
inside.
For anybody who has gone through great distress, you do feel like you're aging rapidly during that stress.
So I was so I was in my mid 40s, and yes, nobody questioned that I had stress, but it wasn't until it all came to a head that I looked back and said this was end organ damage due to my nervous system being completely fried and on overload, and my.
And what does that mean? What happens inside?
So for example, the things that I had. I was in my mid 40s. I was healthy. I generally am an active person. I eat pretty well, and sleep was, with the job, sometimes not great. But I started getting sick in multiple ways, physically sick in multiple ways. Of course, mentally, I was anxious. I was depressed. I'm on all the time, too much caffeine. Am I manic? I'm questioning my mental health diagnoses, but physical manifestations that I thought were all different things. So severe intractable migraines, to the point where I had to get, 31 injections of Botox into my skull every, 3 months, not cosmetic, just, to ward off the migraines. TMJ, not just clicking or clenching, and I would clench at night and the bite blocks and all the things, but I had an MRI and we have these little discs in our TMJ joint, gone. I blew them out. They're non-existent. But the inflammation that ensued, I couldn't even sleep on either cheek on a pillow because it was so tender to the touch. This is not in your head stress kind of stuff. This was actual inflammation in the body. Which begins with the stress. Yeah, of course. Looking back, I realize now where all this came from. But there was a point where I was literally locked down. I couldn't even open my mouth. I remember my colleague in the doctor's dining room at the hospital saying, "Karen, why is your food bouncing off of your teeth? You can't even open your mouth to get a whole fork full of food in." And I was so
And you're attributing that to just that thing.
Right. So I thought, okay, well, I have migraines and that's a thing. I have TMJ and that's a thing. I had IBS, bloating and just, uncomfortable bowel irregularity, and but never feeling like I could eat things comfortably without having an upset stomach, and weight fluctuations, so much pain and tension in my neck. I'd go to get a massage and find the biggest guy with the meatiest hands and just be just dig in there, and he's like, "What's wrong with your body?" And I was like, I don't know, maybe. And then I start catastrophizing I have some, rheumatologic disorder like myositis or something. So I literally go to the rheumatologist and I get blood work and I'm imaging studies. That must be a separate thing. And my gut is a separate thing, and my TMJ and my head. And so I had like and my thyroid, as far as like endocrine disruption, becoming hypothyroid, and that probably started with hyperthyroidism now that I look back, and then burned out my thyroid. And
I wonder how many people are relating to this, because as you're talking, I have TMJ. Like I went through a TMJ specialist in Palm Beach actually, and had Botox injected in here and went through this whole like process. Never once did I even consider that it was stress. Not once.
They were all separate things. I had to go to I went to the endocrinologist, I went to the GI doctor, I went to the neurologist, and I was like, can you all like talk to each other? Can you find a unifying diagnosis? Maybe I have some rare, awful thing or maybe this is what it's like getting older. I'm in my mid 40s. The rest of my life is just downhill. And maybe you're just supposed to have aches and pains and things start breaking down. And truly that is, aging, senescence, death of healthy tissues. But why? So, this term, it's been kind of bounced around for a while, and it's starting to become like less marginalized, less woo. Psycho-neuro-immuno-endocrinology, right? Just like it sounds, right? The mind, psycho, and then the brain, neuro, how those two come together to impact our immune function and our endocrine system, our hormonal function. And I had all the things.
Right.
And the root was unbridled nervous system reactivity and complete lack of resilience, the ability to recover from acute stressful events throughout the day. Stress is not bad. Stress is necessary for life. It's inevitable, but it's also necessary for survival. If we didn't have a fight or flight stress response, we would all be smushed or eaten or something.
So if someone's listening and they're trying to like imagine what you're talking about, like when you have like a trigger or something. So like for me, it would have been at that time my daughter, right? So the school calls. Oh yeah. Then my body just sort of lights on fire.
Yeah.
Right? So that is your nervous system not being able to sort of, because you should have a reaction like if a bear were coming, of course, obviously. Right. But I think moms really understand that. And I think there's this sort of idea that we're just supposed to live like that.
And not only the reaction in the moment, right? Because it's understandable to have a fear response, right?
Right.
Especially if you've been dealing with a kid who's not been doing well and everything's a little scary. It's the recovery, it's the resilience, the ability to toggle,
sort of
dial it back down.
Okay.
And it's so funny. I've been well, I've been better now for probably 5 or 6 years. But it just was like 6 months ago that this thought came to me that like, I didn't know I had a choice.
Yes.
I didn't know I had a choice. I just thought that was just how it was when you have a stressful life and you're juggling a career and parenting
that's
and
what women
sick
think.
care.
People say to me all the time when they find out like my husband passed or something, they say like, how did you do it? And I every time my thought is, well, what was the option? What was I going to do? Right. Jump off a bridge? There was no option. So I think women feel that way a lot.
Yeah.
And I've just now, after my fall, I'm sure you heard about that. I fell and 20 stitches in the face and this whole drama, which apparently was low blood sugar. But because of that, I've started researching the vagus nerve and the nervous system and all this stuff. And Dr. Flannery, I have to tell you that I am horrified that at 51 years old, I have not been educated in the biggest nerve in my body. Like, why is that?
Well, don't feel so bad because I went to medical school. And not only did I go to medical school, I started out, I didn't know that I was going to end up doing internal medicine. I thought I would do neurology or psychiatry. In fact, my major in undergrad, they had an option for independent plans of study. I was like, I want to know everything about the brain. So I actually proposed to the dean and created this whole program that was like neuropsychology or study of the neurosciences or something. And I pulled together and it was cool. And I did all the studying. And then when you're in medical school, before you choose a path and a residency, you rotate through. And so I rotated through neurology and I was like, well, I thought I wanted to like know the brain, but that's like a little, it was at the time, it was like a little sad. Like my grandmother was dying of Parkinson's and there really wasn't much good treatment then. People have strokes and they seem to never really totally recover. And I was like, well, I don't know that I can really truly help people in the way I want to. I knew I didn't want to be a neurosurgeon because I'm not inclined to be in the OR all day. And psychiatry was fascinating to me, but I was like, it's like neck up only. I think I need to like understand the whole body. And fast forward in my journey, it's really, it's mind body. It's all right.
It's really interesting that your journey really fits what
your
your original,
I came back around,
was.
right? But I didn't do like neuro and psych, right? I did internal medicine. And then it was only in my own healing journey and my discovery for how to like save my own life and then rally and try to figure out how to be the best version of myself so that I could be a good mom, not to fix my kid, but to show them that we have to take care of ourselves. And it wasn't until, by the way, I did that my daughter was able to figure out that it is her journey and she needed to do her own work. And so like we're all so much healthier and better. But the thing that I didn't think I had a choice was not just like, the whirlwind, the crazy stress. I didn't know that I had a choice to not be a bottom-up processor. I thought that and this is where, coming back to your point of, I went to medical school and I didn't know what I didn't know about the nervous system. I'm like, yeah, of course we learn about the brain and the nervous system. And I did all these extra classes and, it's the sympathetic and parasympathetic nervous system is taught. Yes, the vagus nerve, it's the longest nerve. It innervates our guts. Like conceptually, we learn all that. But, we are evolved higher processing beings, right? We have this beautiful prefrontal cortex that gives us the ability to pause and reflect and consider consequences and inhibit impulses. But that completely goes offline if we live in a fight or flight state. And what is fight or flight? It's fear-based. It's bottom-up processing where we're just trying to save our own lives every minute. We're like a lizard that's about to get stepped on or, escaping from a saber-toothed tiger or whatever analogy you want to use. And we have to do it because of survival or we will die.
So when you're doing that, so when you're triggered and you're in the survival, you're not able to access what?
It's actually like a small miracle that I was able to be an effective doctor. I probably could have been like an amazing doctor in the hospital if I could have been more really online. And maybe that was my escapism, is I could kind of shut my other stress of my life off and just channel it into patient care now that I think about it. But yeah, to be fully reflective and fully present for our kids, our self-care. If we are just feeling like we're in survival mode and we're hyper reactive and everything is driven from our primitive nervous system, then we're just kicking out cortisol all day long. And that cortisol is so toxic and it starts to cause, wreak havoc on our gut health. And we're learning more about the, gut-brain axis. There's real science behind that. That stuff was woo 5 years ago. And now it's like, wait, why was my gut a mess? Like now, fast forward after I fixed my nervous system and learned to regulate my nervous system, I almost never get a headache. I barely take a Tylenol. I told my neurologist years ago, I'm like, I don't think I need that Botox anymore. And she's like, oh, but you could get rebound and it could be harder. And I'm like, I think I'm good. Like I knew when I was good. My TMJ, I have no discs anatomically, they're gone, but I can chew fine. I don't clench. I don't need a bite block. I have no pain. I can open my mouth wide. Like, how did that get better if my discs are anatomically destroyed? IBS, I eat everything. I eat everything. I don't have food intolerances or sensitivities, and I don't get bloating. Everything just feels like it works normally. I sleep, like a dream, and I forget to get, massages because I don't have pain and tension. I go because
and
it's
you're
a good
7
idea.
years older.
And I'm 7 years older, but if you even ask my family, they're like, Karen, you're young, like you're younger, like you have reverse aged in the last 7 years. And it's not because I took any pharmaceuticals or found the best specialist to fix me. Like it was a self-healing journey, and it started with nervous system regulation.
So let's get into that. I'm like so into this right now. what does that really mean? Because, people are starting to say stuff like that now, right? It's kind of like a hot topic.
It is. It's awesome.
What does it really mean? And how can someone start the action of actually caring for their nervous system?
Sure. Great questions. Learning to regulate our nervous systems means it starts from a place of mindful awareness, just sitting in the present moment, right? Jon Kabat-Zinn called mindfulness, paying attention on purpose in the present moment without judgment. And I like to add, without reactivity. Everything is stressful. There's stuff all the time. We're getting triggered. We're getting pop-ups on our phones. We're getting people cutting us off in traffic. They're all external stimuli. Learning to just notice and sit with those, is a fundamental skill. Meditating is a great way to practice, right? We've got this beautiful, free, abundantly available tool that is our breathing. And it doesn't have to be necessarily a breathing type of meditation if that's triggering for some people or uncomfortable. It can be a, mindful, sights and sounds and five senses kind of thing, but really understanding the principles of mindfulness. And so I would try, guided meditations because I really struggled to do it on my own. I love the Calm app. I would use that religiously, at least every morning. I can do 11 minutes in the morning before I get up and start my crazy busy day. And my mind is like, still going in a million places. And I'm like, I just got to minute 11 and I don't think I paid attention to 1 minute of it. I'm like, I'm a total failure. I cannot even, not only can I not meditate, I can't listen to somebody else telling me how to meditate. Like, what in the hell? And so then I learned about MBSR, mindfulness-based stress reduction. And it's like a curriculum. And I'm like, okay, I'm a good student. I can take a class. So I took somebody's class and it was pretty good. And I'm like, okay, so you learn all the different mindfulness practices. And then I still struggle to put it into practice. And then one day this lovely gentleman came to speak at the hospital where I was working still at the time. He was a retired physician, neurologist, who has now become a very dear friend and colleague on our team, Gus. And he provided a scientifically based educational presentation to doctors and nurses in the hospital about mindfulness-based stress reduction and how how this stuff actually works. It's so impactful and the science behind it. And I was like, okay, I'm doing this. And he's like, and I teach an MBSR course. I'm like, okay, well, I already did it once. I'll do it again. So I did it with him and it got better, but I was still in my stressful life environment. And I found I was showing up for classes and I was present, but I'm still sneaking a look at my phone. Did I miss a text? Do I need to check a lab? Do I need to get back to somebody? Oh my gosh, what's on my calendar after this? And even still struggling to kind of take it down. I'm like, what? I can see why people drink and take pills to just take it down. And thankfully that never became an issue for me. I do happen to work in the recovery field. I don't happen to have a substance use disorder, but I understand why people, if they feel like they don't have their own means to regulate their nervous system, they turn to a chemical solution.
Well, sometimes you don't know that your nervous system isn't regulated or that there is something. When he did that presentation, is there any specific science that you can explain in a very
just some examples. Simple? Yes, either in that or in things that I have read, just how it actually changes your physiology. Okay. Right. Talk about caregiver. This is a great example. Talk about caregiver stress and the toll it takes on, let's call it the immune system and the healing of our bodies. There was a beautiful study. I might not have learned this from him. I think I learned this at the Harvard Mind Body course, which is fantastic. They do it every year. Recommend everybody go. But there was a study. You know what a punch biopsy is? If you have a little skin thing and the dermatologist and it hurts a little bit and leaves a hole and then it has to heal up. I think they put one stitch in it or whatever. But so they literally randomized two groups of women, I think in their 50s-ish, that were caretakers of a parent with Alzheimer's, one of the most stressful caregiver roles. And they, let's see, both groups had punch biopsies. One was half of them were caregivers of a parent with Alzheimer's, half were not. Half just had a regular, normal, stressful life, but that's the worst, kind of stress. And the people who were caregivers of an Alzheimer's parent, that little punch biopsy took 9 days longer to heal than the people who were not full-time caregivers. Like, nothing else, right? Like they didn't have, cancer or AIDS or some immune problem, but they could not heal. They did not have the reserves, and they could not heal their tissues because they were on overload. And so we talk about nervous system regulation. The approach can be relatively straightforward, but the science behind it is complex. So it's nervous system innervation that leads to a flood of chemicals in the body, right? That everybody talks about cortisol overload and norepinephrine, but also these things that have fancier names like interleukin 6 and, things that are really more at like an immune level that help in tissue repair and actual healing. Or you've heard of maybe mitochondrial health or telomere length, our aging. Meditation, it turns out a great well-done study shows that your telomere length stays longer for a longer period of time, stays healthier if you meditate regularly than if you don't.
Which that contributes to aging.
Yes. Like as we age, if we don't manage our health and well-being and our stress, our telomeres start to shorten, and that results in biological aging. So there's real science that supports this stuff. And I'm like, okay, sold. You got me. Like I'll learn to meditate. My point is, you try a lot of things, right? And of course you do some psychotherapy and some medication management to try to regulate. And I think what really kind of helped me train my own nervous system was something called neurofeedback. Are you familiar with neurofeedback?
Yes, I am.
Have you done it?
No.
Okay. So it's cool. And I'm doing it again. I didn't give myself the permission to like do it in the last maybe 5 years, but it was a big, big part of my early journey 6-7 years ago. And I met some of the most remarkable, scientifically oriented, geeking out on this stuff, people that have been mentors to me in this journey. So I'm kind of turning into one of those geeks myself, but it so helped me to just maybe because I'm like a scientist at heart, but I needed to see something objective, right?
Sure.
So like if you go to the cardiologist and you're like, I might be having some chest pain, like they're going to take an EKG and look at the electrical activity of your heart. If you're like, I'm having really bad chest pain, they're going to send you to the hospital and draw cardiac enzymes and blood biomarkers and then risk factors. What's your blood pressure? What's your cholesterol? Like we have data, right? For our heart health. But when we talk about our brain health, obviously if you're having a stroke or something like that, you're going to get an MRI. But if it's like your mind, what objective data do we look at to understand the health of our mind and our nervous system? And so when I was first able to do a brain map, 19 placements of sensors, 19 channel quantitative EEG, and see collectively how this nervous system of mine, I'm being a bottom-up processor. My primitive fight or flight response is keeping me in overdrive in the areas of the primitive base of our brain that is responsible for keeping us from dying because we're hypervigilant all the time. We're always on. We sleep with one eye open kind of thing, right? That was on like nonstop. And the areas that were, or the frequencies of brainwave activity that are responsible for being able to kind of shut it down, to sleep restfully, restoratively at night. That's where we clean up all the junk out of our brain and consolidate learning and memories is in our sleep. If we can't really fall into that deep state of restorative rest, even if it's non-sleep deep rest during the day, it's impossible if we're in this perpetual state of overload in our primitive nervous system. And so seeing that was my biology, some objective data, and then being given the tools through neurofeedback combined with mindfulness coaching helped me realize that I don't have to jump when my nervous system says jump. I can pause, notice it, and choose. And it's actually ridiculously simple, but it wasn't easy.
Well, the journey to getting to simple is often very hard, right?
Right. But I was like, man, I went to medical school and everything. Like, shouldn't I have known this stuff? But they don't teach this stuff. And I hope maybe they do. And maybe I'll get asked to teach somewhere someday, like about helping people help themselves. Now there's wellness committees and all this kind of stuff in healthcare systems. So we'll get there. But like right now, we just need to figure this stuff out for ourselves. So does everybody need neurofeedback? No. But what neurofeedback did was it allowed me to see my brainwave activity in real time while I was, a hot mess and my nervous system was, frazzled, and then sending rewards. It doesn't put anything into your brain. It's not like TMS or ECT. What it puts into your brain are rewarding cues, visual and auditory cues. And it basically, every time it senses that your brain wave activity is like in that calm but focused space, kind of where we want to be, it lets you kind of see what you're watching in full color. It lets you hear the pretty sounds of what you're listening to.
It's attempting to sort of rewire.
It is, but it's not. But it's actually our brain learning. It's enhancing neuroplasticity, which we now know we have for our lifespan. Neuroplasticity isn't always positive. Neuroplasticity is just repetition and, neurons that fire together, wire together. So, if you do some bad behavior over and over, you're you're wiring those things hard. And so that's why bad old habits are hard to break. Addiction, right? But it's kind of like anything. A patient told me, his guitar instructor told him, don't practice mistakes. The more you practice it, the more you hardwire. I must be playing this mistake over and over. I'm doing that well, really good at making mistakes. And so just noticing what we want to change, setting our intentions, but we can't engage our higher cortical function, our prefrontal cortex, our executive function, if we're just in survival mode in fight or flight, or freeze, if we're fearful all the time. So letting go of fear.
I think that a big part of it is just knowing that it's possible. I think that's one of the reasons I want to do this podcast, is so people tell their vulnerable stories and figuring ways out of that, whether it be, your attempt, out of it through education and your medical experience. Variety of people have different experiences, but I think the first step is just knowing that there is like a possibility to live life not from the bottom up.
Absolutely.
What would you say if you had to give someone one or two things that they could do to start today that don't require them to go see do neurofeedback? Like, is there anything that's simple?
One of my mentors said this loud and clear at a time that I needed to hear it most. And she said, slow down. We are moving so fast. We have not only zero, like negative delay of gratification, right? We used to go to the library and look something up, and then we had the internet, and now we have ChatGPT and we get an answer to all the world's questions in a second. Anything we have is in this beautiful mind of a computer at our fingertips, and that these things have rewired our brain. And I'm not vilifying the phone, like it's where we are now, but our brains are moving so fast, and there's so much stimulation coming at us all day, every day, all night. We keep it next to our head. We respond to it immediately. We're driven by these cues, almost like Pavlov's dogs, right? What happened? I'd love to do I'm sure it's been done, a study where we look at our brainwave activity when we get, a ping for this or an alert for that. Just
slow down.
Slow down and just pause and know that we can choose. We don't have to respond to every stimulus. Maybe you unsubscribe from some things. Maybe you turn off alerts and go on do not disturb. That was super hard for me, by the way. I was like, I'm really important. I'm like a doctor, and I have people that might be having a heart attack. Like, I have kids that are sick. Like, I have to be on all the time. And so if you're a caregiver, if you're somebody in the healthcare space, if you have a sick loved one, you're always on. We know in the healthcare and doctor world, you can't be on call all the time. I was.
If you're a mom,
you're on call all the time. Yeah, when you have a really dependent child,
or any kids.
Yeah.
I feel like most moms feel like they're on call all the time. So I like the advice of just simply slowing down.
Yeah.
And I think it has to become a daily reminder, because you remind yourself, and then the next day you speed it up. I think we're just like wired that way a little bit. Well, I love this topic. I think you're going to have to come back for a second time because there's so many specifics when it comes to the medical field, and the topics are heavy, you know, they're sort of hard to like chip away. Yeah. I'd like to do a whole segment on just the nervous system if you're willing to come back.
I'd be delighted.
If somebody wanted to reach out to you and they're interested in more of the concierge service or some of the stuff we've talked about today, where can they find you?
So our website is palmbeachwellnessinstitute.com. Pretty straightforward. We'll have a new webpage up soon about our specific signature brain health program.
Okay.
And we really cover the wellness side of things, more on the recovery side. It'll link you to our recovery pages. Office number 561-802-0929. And just happy to have a conversation with anyone if they're just not even sure. Most people that call us are like, I have no idea what I need. Yeah. And we're like, just talk to us. Let us know, you know, where you're at, what you're going through, what you've tried, and what you're open to. And mostly we just love when people get humble and are like, I don't know what this is, but I want it to be different, and I'm ready for help. And we're here for them.
Awesome. So if you're looking for Dr. Flannery, that's where you can find her. Please subscribe and download our podcast. See you next time on Cake for Dinner.